It is, like, yeah, it is. Oh,
yes, do what you have to do.
Hey, God, this is so bad. Oh, I have, oh.
Hi there, my name's Mark, I'm one of the doctors.
Oh, hello, Mark.
Could I just check who I'm seeing and your date of birth, just so I've got the right branch?
Oh, right, it's Sharon Branch, the 5th of the 4th, 1949.
Hi Sharon.
Oh, sorry, Jackson, pop this in your ears.
It's okay.
How are you feeling?
Oh, I'm in pain. Oh, it's so good.
So what's exactly happened?
Well, I was having tea and biscuits in the garden with my sister because I can't get out with COVID, so we just catch up in the garden. And I went in to get the biscuits. I just picked them up off the bench, stepped out the back door, and I must have tripped over one of the flagstones or something. I just went down like a bag of hammers. And then our Lily came running to my sister to try and help us up. But when I got up, honestly, the pain, it just saw down my leg. It was tearing pain. It was awful. So she rang the doctors, and he got an ambulance and the ambulance brought us up.
Oh dear.
Dear me.
And how's the pain at the moment?
Oh, it's terrible. It's really bad.
And if you had to give it a score out of 10, 10 being the worst.
10.
10.
I think 9 to 10, but if I move it, it
Oh,
goes over 10, I tell you.
So we'll make sure you get some pain relief
that'd be
in
good.
pretty quickly. Okay. Ashley, would that be okay if you...
Yeah, I'll take these off and I won't get that sorted.
Thank you very much.
Morphine? Are you okay with morphine?
I've not had it before, to be honest.
Well, we'll give it a try and see how you do it.
That would be good. And then I just need to let my sister know what's
I'll do
happening.
that, no problem.
And when exactly did this happen?
I only came up about 2:30. So it would have been between 2:45, 3 o'clock, I think.
Okay. And you say it's the left hip, obviously, we can see from how it's
This
looking.
one, I haven't seen it, I thought it was badly twisted that.
Okay, it is, yeah. And does it spread anywhere else at all?
No, just right down my thigh.
Oh. And does anything help to make the pain a little bit better?
No, it's if I stay still, it's still sore, I would say. It's going 8 when I'm still, but if I move, it goes 10 and above.
Oh dear. I'm just going to ask a few more questions about what exactly happened with the fall. Okay. So how were you feeling before it happened?
I was fine, like I say. We were just sitting having a cup of tea in the garden and just went in for the biscuits and then poof, down like a bag of hammers. I just assumed I tripped over one of the flagstones.
Yeah, did you have any sort of warning you were going to fall, or was it quite sudden?
No, I just went down, which is why I thought maybe I tripped over something because I was quite surprised.
So you didn't have any sort of pain or dizziness or shortness of breath or anything?
No. I was a little bit dizzy when I first stood up, but it was hot in the garden. I've been drinking a cup of tea and I thought, take me time. But no.
Okay. And then, I know it's a strange question, but as you were falling, what happened there? Did you put your arms out? Did you land on one side?
No, honestly, it was a shock. I just went down. Didn't get anyone, it just hit the ground. And the next thing I knew, Lily was panicking over the top because she's a right worry, I think.
And where exactly in the garden way? Was there anything else around? Did you hit anything on the way down?
I've just got the patio outside the back door, and I've got a little table and chairs there, and we're just sitting there. Like I say, I just stepped down out the back door, started to walk across, and down I went.
And how did you feel afterwards?
Well, I was a little bit disorientated really, because next thing I knew I was just lying on the floor now while Lily's having a panic over the top of us. But yeah, other than the pain in my leg, that was the main thing.
Yeah, absolutely. Did you feel sick at all at that point, or any pain anywhere else?
No, not really. I guess the pain made us feel a bit sickly, but I wasn't feeling sick, if you know what I mean. And no, that was the only pain really, was my leg.
Okay, so you would say the main thing was just the pain in your leg?
Oh, definitely, yeah, it's just so bad.
Oh dear. So just to clarify, so you stood up and then you just suddenly just hit
well,
the floor.
I stood up and I walked to the kitchen picked up the biscuits because she likes ginger nuts, so I got
Yeah.
my ginger nuts. Took them back, stepped out the back door, and I must have took 1 or 2 steps and then straight down on the ground.
And as we said, there wasn't any sort of warning sign or anything
No,
like that?
no, just went straight down.
And didn't hit anything else on the way down? Landed on your hip, you think?
I think I must have landed
Yeah.
on my hip,
And then just the pain, nothing
yeah.
else. And do you feel like you might have blacked out at all or anything?
I'm not sure, to be honest. I can't remember much when. I just remember walking out with
Yeah.
the biscuits and then down I went.
And did Lily see this fall?
She did, yeah, because she was sitting on the patio on the table.
Oh,
And she's obviously covering as soon as she's seen us go down.
okay. Well, that's great. We've got quite a good picture of what's actually happened. But if it's okay with you, we'll ask Lily a few more questions
yeah, she'll
about
be
what's
happy
happened.
to talk to you, she will.
Yeah, just so we can get sort of from her point of view, just in case something else has happened
Yeah,
as
she
well.
saw us go down, I guess.
With just being a little bit unsure of exactly what's caused that at the moment, just getting as much
Right,
information as
that's
we can
fine.
will probably help us.
No, she'll
get
be
to the
happy
bottom
to
of it.
talk to you. Yeah.
Oh, no. And is it okay if I just ask you a few more questions?
You can.
Just about how you are normally.
Yeah. Oh.
Do you have any problems normally? Anything you see your GP about?
No, I've got high blood pressure and just osteoarthritis. Well, at my age, I'm going to have a bit of that, aren't you? But that's all. I'm normally okay, really.
And did you take any tablets for those things?
No, what's it called? Amlodipine. That's what I take for my blood pressure, and just paracetamol if my bones and joints are a bit achy.
And anything you're allergic to?
Not that I know of.
Great. And so you say you take the paracetamol and things. How are you with ibuprofen and things like that?
I never take that. I never like them ones. My mother never used to like them because they upset her stomach.
Oh, okay.
I think one of our friends had a bleed in her stomach or something,
Oh,
so I
dear.
never touched them.
Oh yeah, no, I understand that, yeah. And based on, with you having the problems with arthritis, how do you get around at home normally?
I'm all right, you know, I'm canny. I do my own shopping, I do my own cleaning. But then, you know, before COVID, me and Lily used to go to UK and do a Tai Chi and stuff like that. So I'm all right, really.
Oh, great. And do you need any help around the home?
No, I do it myself. I mean, yeah, well, Lily comes and helps a little bit, but that's because she likes to interfere, to be honest. But no, I do everything myself.
And do you use any sticks, any frames, anything to help you get around?
No, I'm fine.
Great. And is it a house or a bungalow?
It's a bungalow.
Oh.
Yeah.
And so when you're out and about, do you have any problems, say, with getting up and down stairs or anything?
No, not really. I mean, you know, coming up 70, so you know, if I'm out in the shops and stairs, you get a bit tired, my joints ache a bit, but it take me time. But other than that, no, not really. I manage myself.
Okay, that's great. And so there's a few things we're going to do for you at the moment. Obviously, we're going to, Ashley's going to get some strong pain relief for you.
Oh, that would be
And we'll put a little drip in your arm just so we can give that pain relief.
Oh, right.
Get in that bit quicker
Right.
for you. Just get you a bit more comfortable.
Uh-huh.
I think we do need to x-ray that leg.
Right.
It looks like most likely that it's broken, unfortunately.
You know something, I was worried about that because my mum broke a hip when she was
Yeah.
a bit older than me, and when I seen it I thought, I'm worried about this, I think it's broken.
Oh yeah, absolutely. I mean, it is most likely at the minute. Obviously we won't know for definite until we get the x-ray, but it just looked like there could be a problem with that hip and that it could be broken. And then because of that, we'll then having to get in touch with the orthopaedic team as well to see whether they need to operate.
I hope it's not broken, but I was suspicious about it, to be honest, with the pain and just because it looks a bit funny.
And is there anything you're particularly worried about at the moment?
No, I didn't really want to have surgery, but there's nothing you can do now, it's done. And just if somebody could let our Lily know what's happening, because she'll be worried.
And is Lily
My sister,
your sister?
yeah, she's my next of kin.
Yeah, so we'll make sure we let her know. So I'm just going to do a little examination of your hip, but we'll get that pain relief in first. Is that okay?
Yes, right, please.
So we'll just go and get that pain relief for you, and then we'll get started.
Lovely.
If that's okay.
Thank you very much.
Do you have any more questions?
No, it's fine. No, I think that's it. I think my worst fear was that it might be broken. We'll just get the x-ray and see.
Yeah, absolutely. Yes. Well, I'll pop back in a little while. Okay.
Okay, thank you very much, Mark.
Hi, my name's Mark. I'm one of the doctors. Is it Lily?
Yes, it is. Hello there. Hello,
Hi.
doctor. Yes,
I
I'm
understand you're Sharon's sister, is that right?
I am, yes. I was Sharon.
And so I've just been to see her after her fall.
Yes, all right.
Well, she's in a bit of pain, but we're getting that under control at the moment. And were you there at the moment?
Yes, we were just
happened?
sitting
Yeah.
having a cup of coffee.
Mhm.
She'd gone in to get some more biscuits. And then all of a sudden, oh dear me, she just poof.
Oh dear. Is it alright if I ask you a few more questions?
Of course,
It's just so we'll get a
Yeah.
good picture of what's caused it, really. And so, what happened before she fell? Just the moments before it happened?
So she came out the kitchen door, just carrying the plate with the biscuits on, and then all of a sudden, just down she went. Nothing kind of happened. I don't think. I mean, I was just sitting watching as she was coming out.
And did she mention she was feeling unwell at all before it happened?
No, she was fine.
So she didn't complain of any pain in the chest or feeling short of breath?
No, she never said nothing like that. No, she just said she wanted some more biscuits.
Oh, okay.
And she'd gone into the kitchen to fetch them.
And you say she was coming out of the kitchen and made it.
Yeah, she has a little table, on the just outside the kitchen window, like on a little sort of patio bit. And she came through the kitchen, through like a little utility where our washing machine is and that, and like round towards me, just carrying the plate of biscuits, and then all of a sudden, what a clatter!
Oh dear, that must have been pretty scary.
Oh, she couldn't half frighten me. Mind, yes.
And did she lose her footing at all when she fell?
Didn't see. She's got like a little rim thing, sort of like a across the door, like like a wooden thing that. But I don't think she tripped over because she's been out there hundreds of times and she knows it's there. Like where the carpet fits. From the utility. But no, I don't think so.
And when she fell, did she hit anything on the way down? Did she bang her head at all?
I didn't see her bang her head. She just seemed to be down, and that was it. I mean, the bins are sort of there, so she wouldn't have caught them.
Yeah. Oh, okay. And do you feel she blacked out at all?
Well, when I was standing over, I kept saying to her, Sharon, trying to wake her up, but she seemed as though she was just for a few minutes, just not answering us, and that did frighten us a little bit. Because I thought had she bumped her head or, because it's concrete, it's not decking yet. She's going to have that done. But she's always talking about it. But I just couldn't get her to sort of say her name. I was shouting at her, if you like.
So is it possible she might have bumped her head, do you think?
She could have done. She could have done. I mean, like I say, I just saw her go down and I stood over and I was shouting, come on, wake up, and trying to get her, well, I can't lift her. My knees are bad as well. I couldn't get her, to stand or anything because she just wasn't talking to us.
Yeah. And did she shake her limbs or move her limbs when she was on the floor?
I didn't see her do that.
Yeah.
But that's not to say, mind, because I didn't see it, it didn't happen.
And when she came round, how was she feeling then?
Oh, she was a bit muddled, really. She was I was where was she? And I was here in the garden. It's me. And I was saying to her, it's me. I'm here. It's all right. Yeah, that was a bit strange. It was a bit sort of, It
does sound like it's been quite an awful experience for you.
Well, I just got such a fright when she just went down. Because like I say, she'd only just gone in the kitchen. And she was fine when she went in, and then all of a sudden just poof.
Did she mention any pain or any problems when she was coming around?
No. No. She just said she felt pain in her leg.
Yeah.
In her hip, in her leg, and going down, and all the rest of it, down to sort of the bottom of her leg. And her leg just didn't look right.
Yeah. And with her potentially, we're not sure, but potentially hit the head, does she take any blood thinning tablets at all?
Oh no, I take those. No,
Oh,
so I know she doesn't take those.
Oh, right.
Because I take those.
Yeah.
The one that you get the book with and you go and you get I take those ones. But no, she doesn't.
Oh,
She's always been really fit and she's fitter than me. But then she's younger than me.
Oh.
Because I'm the eldest.
Oh, right.
And I only live a couple of doors down, in the bungalows. But, I pop down and I give her a hand with a cleaning and things like that. And we'll go shopping together, we do most things.
Yeah. And as far as you're aware, any change to her medications at all? So anything new or anything that's been stopped?
She would tell us if there was something new, but
Yeah.
I don't think she has.
Or if they changed the dose of any of the tablets?
She's never said mind. But then sometimes things like that she doesn't tell us, that she keeps not secrets, but she doesn't tell us things like that, because she knows I worry.
Yeah.
And I would worry about that, if I thought that she'd had more tablets or if there was something wrong with her. And I just got such a shock, when she just went down.
Thanks very much for talking.
Okay, that's not a problem.
Hi, my name's Mark. I'm one of the doctors. I've just seen a patient I'd like to have a chat with you about. Is that okay?
Yeah, sure.
And you're the orthopaedic registrar, is that right?
Yeah, that's right.
So we've got a lady, 75, called Sharon Branch, who's fractured her left hip. So she's had a fall in the garden. We're unsure exactly of the exact mechanism of that fall at the moment. So there's a few other things we're going to be doing with regards to that. But generally, she's fit and well. She does have arthritis and takes amlodipine for high blood pressure, but aside from that, she's fit and well. She manages all of her ADLs independently. She lives alone, doesn't walk with any aids, does everything for herself. And we're just wondering if you could go and see her to decide what we do from here in terms of whether she's going to go to surgery, and if so, for what operation she's going to have as well.
Yeah, sure. So from what you say, she seems, obviously we need to fix her hip, and it's all about which hip, which operation that we do to help her.
Yeah.
Then you say that she manages all of her activities of daily living, washing, cleaning, everything like that.
Yeah.
And normally, do you know how far she walks on the flat when she's well?
So we don't know exactly how far, but she does say that she normally does things like Tai Chi and exercise classes when things are normal. So we do think she has got quite a good exercise tolerance from that point of view.
And she's living without carers in her own home, so she must be fairly good in herself functionally. And you mentioned that she's got this left hip fracture.
Yeah.
Is there anything else going on? Are there any problems with the blood tests or any other issues?
So we've sent a group and save and a cross match, and we've done a full set of bloods, so full blood count using these LFTs, CRP, and a coag screen as well. And so far, nothing's come back as abnormal from that point of view.
That's great. Yes, certainly. I think we best go have a quick chat with her. Do you know if her pain's well controlled at the moment?
So we've given her some IV morphine as well, and one of my registrars is going to put a hip block in as well from pain relief point of view, just to make sure she doesn't get too much morphine.
Yeah.
But at the moment, she's had some IV morphine.
Great. So we've got pain control on the go. We've got all the right blood tests sent. I suppose it's just it'd be good to get a chest X-ray, just because the anaesthetic team will want to know that, and I'll go up and have a chat to Sharon, because there's a few potential options we can do to fix a hip. And I think it sounds like she probably needs a total hip joint replacement, really, given how good she is functionally. But we can have a chat with her about what the best thing is to do. The trauma list is quite busy at the moment, so I think she'll probably get done tomorrow. So I think if we try to keep her nil by mouth from midnight, that'll keep our options open.
Yeah.
Is that all right?
Great, yeah, thanks very much.
Perfect, thanks.
Hello, Flower. I'm doing that injection you give
Did
has
it
helped.
work?
Oh, it has.
Oh,
It's helped
that's
an awful lot. I can still feel it, but it's helped a lot.
Oh, that's
Thank you.
The doctor's coming in because he's got some results and things.
All right. Let's find out what's going on.
Hi there, Sharon.
Hi, Mark.
How are you
It was
feeling?
Mark, wasn't it? Yeah. I'm a lot more comfortable now. I feel a bit tired, actually, a bit drained now, but more comfortable since I had that injection.
Okay. So I've just had a conversation with the surgical team. So we're just gonna let you know what's happening really,
Right.
what we're gonna do
Yeah.
here. So from the X-ray, you have broken that hip.
Oh, I had a feeling I had because I seen the same thing in
I
my
know, I'm
man.
sorry.
It's all right. I half expected it. Don't worry.
And the surgical team are going to come down and see you.
Right.
So there's a few little bits we're going to do to tee you up for them really.
Right.
So at the minute we're just going to make sure you don't have anything to eat or drink,
Right. Okay.
just until they've decided exactly when they're going to operate, but we'll make sure you've got a drip going
Oh, lovely.
and
Right.
that sort of thing.
Right. Yeah.
And I've spoken to your sister Lily as well.
Oh, great. Is she all
About
right?
just to clarify, oh, she's fine, yeah, she's just concerned for you. Really.
She will be. She's a warrior, man.
And it was just to clarify some things really,
Uh-huh.
from that point of view. So there's a few extra things we're going to do. So just to make sure that you're absolutely fine,
Uh-huh.
a few things we're going to do is we're just going to make sure that you're okay from the heart point of view really.
All right. I've not had
It's-
problems with my heart.
Yeah, I know, but it's just based on what happened with
Right.
the fall really. So
All right.
we're just going to get an ECG, a tracing of your heart.
Right.
Okay.
Okay.
And we're going to keep those sticky dots on and just keep you attached to a monitor just to make sure everything's okay from
Right.
From
Okay.
that-
That's
from that
fine.
point of view,
That's
is that
that's
okay?
fine. Yeah.
and we're going to do a few more observations and things.
Right. Okay.
It's nothing to worry about at this point. We're just dotting the I's, crossing the T's. Really.
That's fine. You've
we're
got to
just
do
being-
your job.
We're just being really safe and make sure we don't miss anything.
Thank you.
That's the main thing.
Lovely.
And just to make sure you're in the best possible condition before you have your operation.
Okay.
Okay, but
Yeah.
the surgeons will come and have a little chat with you as well and explain the options and what they
So
potentially
will I have
might
my
do.
operation today, do you think?
We're not sure. They have said they are quite busy,
Right.
but someone will definitely come down and see you shortly, and then plan things a bit more, make things a bit clearer from that point of
Lovely.
view.
Okay. Thank you very much.
I do think you are due another set of obs, so your blood pressure, your
Oh, that's
temperature.
fine. That's fine.
That
I'll get
sort
well
of
looked
thing,
after.
So we'll get that sorted as well.
Right.
And how's the pain at the moment?
Oh, it's much better. It's still not completely gone, but it's bearable at the minute. I just like to go to sleep.
Oh, yeah, so it's been a trying day for you.
It has,
hasn't
it
Yeah.
has.
And you've got one of those buzzers, yeah, if you need
I
just
have,
the
yes,
one, yeah.
Ashley's give us the buzzer down here.
So you just press the buzzer if you need anything. We have got more room, more wiggle room for pain relief, what we can do for you as well. So if you're feeling uncomfortable at all, just
Lovely. Thank you very much, Mark.
And do you have any questions at all?
No, I think you've explained everything well enough. As long as our Lily knows, that's fine.
Yeah, we'll keep her updated as well.
Lovely. Thank you very much.
So we'll see you shortly.
Thank you very much. Thank you. Oh, what a nice little doctor he is.
So welcome to Wednesday's MDT meeting. We're just going to go around the room and introduce ourselves first. My name is Ashley, I'm one of the sisters on Ward 6.
Hi, my name's Mark, I'm one of the doctors on the ward.
My name's Dr. Calvert, I'm the ortho-geriatrics consultant. Hi, my name's Kaylee, I'm one of the physiotherapists.
Hi, I'm JD, one of the occupational therapists.
Hi, I'm Judy, I'm one of the social workers. And I'm Inga, one of the pharmacists.
So we are here today to talk about a lady on Ward 6 called Sharon. She's a 75-year-old lady, has been in with us for the last 3 days. Following a fall in the garden. There was some loss of consciousness initially when she fell. She's had an x-ray which shows she has a left fractious nerve. She has been struggling a bit with her mobility, and I think she'll obviously need a bit more help on discharge.
Yeah, so she initially came in a couple of days ago. She was walking from the garden to the back door and fell and landed on the concrete on her left hip, and obviously had quite a lot of pain from that. We've tried to speak to family as well, and we've not got a huge amount of history from the daughter. I don't know if anyone else can glean a bit more light on that. So it's not sure exactly the full cause for the fall, but she has been on telemetry and she does need some further cardiology investigations on discharge, but the referral has been sent.
No, I think that's good. I don't think I've got much to add. I think as long as you sent the referral, then from our point of view, she's medically fit.
From a physiotherapy point of view, she's done really well this morning. She did need a little bit of breakthrough medication before, but she's managed to walk approximately 10 metres with the wheels up frame and assistance of one. She's been given all of her exercises, she's doing them really well, and before she goes home we'll have to do the stairs.
From an occupational therapy point of view, I saw her this morning and completed a washing and dressing assessment, and she was limited by anxiety and a little bit of pain from that hip. So I would recommend she has some short-term support on discharge to help her recover when she gets home. She's also struggling with the transfers due to a hip on and off the chair in the toilet. So I'm going to complete a site visit this afternoon at her property and meet the daughter there and provide any equipment that she's going to need for discharge.
From a social worker point of view, obviously if she fails the short-term support discharge, then would have to look at putting carers in the house, but would have to also do like an assessment to make sure that the carers that we put in will meet her care needs.
Sounds like pain is slowing her rehab a little bit. I wonder if we need to get around regular paracetamol and then make sure she has on off before we try anything. I don't know what people think about for home, whether she needs some modified release morphine or we'll just see how she goes with the on and off. The other things I wondered, Mark, is whether we've looked at whether it was a postural drop that caused her fall. I know we've stopped the amlodipine at the moment, but whether she needs some fludrocortisone before she goes. And the only other thing on the letter to the GP is she probably needs a FRAC score and whether she needs some bone protection, calcium and vitamin D or a bisphosphonate.
Right, thanks. No, I think they're good suggestions, Inga. So Mark, if we try the Oromorph this afternoon, and then we can look how much she's needing and we can see about long-acting morphine. And if you have to speak to the family.
Yeah, well,
Actually, can we get a repeat? Should we do a lying and standing blood pressure now she's off the amlodipine? Yes, that sounds good. Yeah. And estimate the date of discharge, are we thinking Friday? Does that seem realistic?
From a physiotherapy point of view, I think Friday is a bit more realistic to get her independent with a Zimmer frame, be able to be safe on the stairs, and get her home from there.
Okay, great. How do you guys, is that okay with you guys?
Yeah, Friday seems like a good estimate from my point of view. We'll be able to get the equipment in place tomorrow, and then whenever the short-term support can start, and I think Friday sounds like the best.
Yeah, sounds like a good idea.
Yeah, great. Let's aim for Friday then.